Hi, I'm Megha Sinha. I'm the CEO of Kamet Consulting Group. We support life sciences teams through high-stake changes, whether it's acquisitions and divestitures, large-scale transformations, or technical advisory, where the work is complex and the margin of error is zero, because patients are counting on product continuity. I bring 17 plus years of experience across industry and consulting, including 8 years at PwC, leading global M&A programs focused on regulatory strategy, supply continuity, as well as operational readiness across global markets. During my time at PwC, I also partnered closely with digital transformation teams to bring practical technology-enabled solutions to our pharmaceutical and medical device clients. Solutions that were designed to be adopted, not just admired. That combination is the foundation of Kamet. At Kamet, we deliver programs that will create measurable value for our clients by pairing deep regulatory and compliance rigor with cross-functional execution expertise and the right technology to make any change successful. Yeah, what I'm watching for this year is really a shift from AI as a headline to AI as an operating system. AI that will matter in 2026 are the ones that are embedded in your work and tied to measurable outcomes for companies. Really the highest conviction implementations are often the unglamorous ones that help company operations. First, anything that reduces cycle time in regulatory and quality work, impact assessments, submission planning, correspondence triage. Second, clinical operation workflows that will reduce operational overhead. So, site activation, enrollment forecasting, things that are really moving timelines and not just dashboards. Third is manufacturing productivity. So, deviation triage, digital batch records, and faster release. Not just more capacity, but really fewer errors and less rework, and a tighter loop from decision to execution. From an investor perspective, they will demand proof, right? What is the upside? Is the cycle time down? Is the rework down? Are the quality events down? And more importantly, to improve timeline predictability. A lot of experimentation has happened in 2025. So it's really about what are the solutions that can be deployed at scale. Otherwise, it won't be treated as transformation. At Kamet, this is why we're working on a capability that orchestrates work across the value stream. So, regulatory, quality, manufacturing, supply chain, and commercial with governed rules and traceable decisions. So, AI actually is embedded in the work and moves the metrics. So, in my opinion, in 2026, AI is only valuable when it's accountable, it's embedded in the work, and it's repeatable. This conversation has matured. If you recall, a few years ago, it was framed as onshore versus offshore or add redundancy. This year, it is much more about how do we add resilience without creating chaos. To make it real, if you think about every move, site transfers, dual sourcing, when companies are bringing manufacturing back to the US, it creates a ripple across the value stream. It impacts registrations, it impacts labeling, it impacts quality controls, it impacts supply chain and market cutovers. So leaders are really rebalancing in a way that investors and regulators can both buy into. Investors want predictability, fewer disruptions, fewer write-offs, and a credible plan that won't balloon the cost. And regulators want control. Did you validate your processes? Do you have robust change control and traceability? The winners will really be the company that can show that they can change the footprint and still keep product supply steady and do so with a disciplined governance. This is why the capability that we're working on really maps the manufacturing footprint changes to downstream regulatory labeling and market cutover action. So a simple change, a simple move does not really become a 40 country program late in the game. Resilience really isn't about capacity anymore. It's about the ability to change fast without breaking supply or global compliance. Yes, I think so. I think we will see more of these structured denounce because market is really rewarding optionality and discipline. Collaboration is moving from big upfront bets to stage commitments with decision points. Really, in other words, risk is being priced and governed explicitly. You'll see more option to buy and option to license structure, more milestone heavy economics, narrow initial scopes to expansion gates, and really co-development model that are tied to specific proof points. And this is not just financial engineering, this is a response to a very real question. How do you keep innovation moving while protecting the downside? To make it real, a great real world example from 2025 is the Novartis BioArctic deal, where they received, 30 million upfront. Novartis had the right to review the results and then, exercise their option to license. And BioArctic received milestone payments up to $772 million after that. That's the market template right now. Stage commitments, clear decision points, and pay for proof. From an investor perspective, though, milestones only de-risk innovation if you can really hit them, if teams can hit them. So, you'll see diligence moving beyond, is the science exciting, to can they actually execute? So regulatory pathway clarity, CMC readiness, your quality systems, your cross-functional delivery, they're all now part of the value story. That's the lens we bring into our work. We're really building a work graph approach that makes dependencies visible, decisions rule explicit, and ownership clear. I think collaborations that win in 2026 are the ones that de-risk both the assets and the execution. So really, the new currency isn't hype about, science. It's optionality with milestones backed by cross-functional execution.